Hi, I'm Rihanna Sturgeon. I'm a Master's Athletic Training student from Texas Lutheran University. I did my compression article on wound complications. After ankle surgery, does compression treatment work? A randomized controlled trial. So a little bit of background. The infection rate after ankle surgery is as high as 19% in some studies. A lot of complications follow just a basic infection after ankle surgery, including death and amputation. So the purpose of this study is to test a regimen of intermittent pneumatic compression, bandage compression, and compression stockings, and its effect on the rate of wound complications. So a little bit of background. There was 153 patients. They were all put into this study if their ankle fracture made them unstable. So in other words, they were going to need surgery. The parties were tested for infection at week 2 and week 6, which were their follow-up appointments. From there, they broke up the two groups into a compression and an elevation, which is the controlled group, and the compression is the intervention. Excluded parties were individuals who had open fractures, DVT, pulmonary embolisms, dementia, no pedal pulse when they first came in, and no Danish address. So if they came in multiple times over the two standard 2-week and 6 weeks, they were deemed complications with the wound or the healing. So that was definitely marked down. So let me break down the compression versus the elevation. So basically with the compression people, they had either a compression bandage, or they had all three, my bad. A compression bandage, a compression stocking, and they did intermittent pneumatic compression immediately after surgery. All these three things occurred. And they would do the pneumatic compression for 40 to 60 millimeters of mercury for 40 to 60 minutes. And they did this 3 times a day while in the hospital. And the elevation group just received elevation at 45-degree angle. So they just elevated the ankle at 45 degrees. So basically results would mean infection occurred. Infection, according to the CDC, is something redness, with swelling, pain, warmth, pus secretion, or an antibiotic is needed. The secondary endpoint was necrosis, meaning it was dark pale and it showed no sign that the tissue was alive. So basically, the primary was to see if infection is going to occur in these compression patients versus just the elevation. And then the secondary was if necrosis was going to occur. So in conclusion, it was not significant. They couldn't see if the compression therapy actually prevented the infection or not. However, the effects of necrosis, it was in favor, and however, that wasn't the endpoint, and that wasn't the goal to look for, but necrosis was significant with the compression. So with clinical application, I would say I would use this post-surgery on people who are at a higher risk of infection, so people who have maybe an ankle surgery. I would also do it just for peace of mind for the patient. So if there's someone that comes in the mornings for morning treatments and they just had ankle surgery, I would for sure have the time and the resources to treat them, give them the compression, and definitely keep up a little bit closer with their wound. Some critiques, I would definitely try to find a way to, even though the study is more infection-based versus, how is the patient feeling, I would still put a pro in there to see how they're feeling, because maybe compression isn't their favorite thing, and they've been on compression for an hour multiple times a day. It's probably not the most enjoyable thing. So I think the patient-reported outcome would definitely benefit the study to give it a little bit more of the mental aspect of what the patient's feeling, along with future studies. I would say that seeing if one compression technique works better than the other, so seeing if the IPC treatment is more beneficial than just a compression stocking or a compression bandage may be better than a compression stocking, and just kind of comparing.